Hey guys, I just wanted to touch base with you and discuss concussions and some of the signs and symptoms related to these injuries and the importance of these injuries just for a few minutes to touch base with you guys. Concussions are fairly common within athletics, especially in contact and collision sports. As you guys know, football, lacrosse, basketball, all of those have a high risk for concussions, but it's also important to keep in mind that concussions can also happen in non contact sports as well. This is really important topic that I need everyone to be aware of. Concussions can be deadly and cause lifelong problems if they're not treated properly. And so, in order for us to give the athletes the best chance at a long quality life, we need to do our best to recognize these symptoms. As coaches and parents, and as the medical staff that's in charge of taking care of your athlete, we all can be on the lookout for some signs and symptoms. And these can consist of moving clumsily, forgetting plays, changes in behavior. So, this could be irregular mood swings, noticing that the athlete is being a little irritable, or we can also be on the lookout for them slurring their words and their speech a little bit. So, there's also signs and symptoms that the athlete could be experiencing that us as coaches, parents, and medical staff can't really notice, such as the athlete having a headache, they're sensitive to noise, they're sensitive to light, and maybe they're feeling a little bit more emotional than normal. And so these are all signs and symptoms that could indicate a concussion. So if you or your athlete is experiencing anything like this, please come talk to me so we can take the proper precautions to keep everyone safe. Reporting any head injury symptoms is really vital to the fact that concussions can cause serious complications. If they're left untreated, these can lead to lifelong emotional, physical, and cognitive difficulties if concussions are not treated properly. In addition, if the athlete sustains a second concussion before the first concussion is fully healed, they're at risk for a condition called second impact syndrome. And with this syndrome, the brain swells so rapidly and often leads to death. So I'm not telling you guys to scare you or to scare anyone else, but I just really want you guys to know how important it is to report any signs and symptoms and that we treat concussions properly. We do our best to limit the risk of concussions, such as trying to limit head-to-head contact in collision sports and keeping our equipment up to date and meeting the standards for safety and certification requirements. But concussions do still occur minus some of our best efforts. As a medical staff, I'm here to keep the athletes safe, and with the help of coaches and parents, you guys can also help contribute to the safety of the athlete as well. Thanks, guys.